For specifically insulin injection patients, yes, you have to first determine eligibility criteria, homebound status, and medical necessity. Part of determining medical necessity and justifying it to an auditor is establishing without doubt, essentially, that there's nobody else to perform the injection. Hi everyone, my name is Miriam Traceman from the Home Health Consultant, and today we're going to be talking about social workers and insulin injections. But first, if you like our content, please like, share, and subscribe. So what do social workers have to do with insulin injections? Seemingly nothing. And also, a disclaimer before we jump in, I am not a clinician, nor am I an ADR specialist. But this topic involves all those subjects. So please verify everything that you hear with your clinicians and social workers, RNs, DPCSs, and whoever else you feel is appropriate before enacting any kind of changes within your company. Often when we speak of like compliance, administrative compliance, like, even HR processes, things like that, I'm very knowledgeable more or less in those things. Of course, regulations vary state to state, disclaimer. But I'm telling you right now, I'm not a clinician. I'm not a social worker. I'm not a nurse. I have nothing to do with clinicals. I've just been around the block and I've seen things. So here is what I've seen. This is a home health specific topic, side note. And again, please verify this information. And this is for entertainment purposes only. So now that we're done with the legal, let's jump into it. As we've said in previous episodes, if you want to pass an ADR, the ADR preparation begins at the first visit. You are not going to be able to successfully pass your ADRs and things like that if you are not thinking about how to pass your ADRs and how to document and perform around it at the time of treatment. By the time you get an ADR, first of all, it's way after usually the patient has been discharged, or it still might be an episode, on treatment, but like it might be an episode that's previous. So it's always like a backtrack more or less, right? And so by the time you get it, everything's been done, signed, submitted. The OASIS is already an IKEY. Like everything's like documented. So what are you really prepping? Like how are you prepping your ADR? The ADR prep happens live during the treatment. When we talk about insulin injections specifically and home health requirements specifically, to pass an ADR, as we've spoken in a previous episode, the very first thing, second thing, third thing, all the way to the 80th thing is going to be establishing eligibility criteria and reestablishing it at every single visit. When you have an insulin injection patient, whether it's QD once a day, BID twice a day, TID 3 times a day, you need to justify your company's presence and reason for performing the service. To go somewhere to 1, 2, or 3 times a day every single day for months, that comes out to a very high dollar amount claim for Medicare. And so they will absolutely scrutinize those claims specifically and really try to make sure that they are appropriate. For specifically insulin injection patients, yes, you have to first determine eligibility criteria, homebound status, and medical necessity. Part of determining medical necessity and justifying it to an auditor is establishing without doubt, essentially, that there's nobody else to perform the injection. So I'll give you some scenarios. You could have a patient. That patient lives with family. Let's say the PM injection the family can do because they're home, but the AM injection they can't do because they're at work or whatever, whatever. And so for a once a day injection, there is no willing or available caregiver to perform that initial injection. And the patient is unable to perform it because this, whatever, there's 1,000 reasons that you can put as long as they're true. So like if the patient has shaky hands, if they have poor vision and, they can't interpret results, if they have some kind of like mental health issues or whatever, things like that. Memory loss, so they're not like consistent with it. There's a million reasons to explain why the patient can't do it. But you need to also explain why there's nobody else in their life that can do it. And so when you're providing that injection, part of providing that injection, of course, you're documenting your service, you're documenting the continuous need for the service. That continuous need justification needs to include that you guys are looking for somebody that can take over. Because the point of home health isn't to have forever patients. It's to help people and then rehabilitate them quickly to some level of independence. If you can't find anyone, not a friend, not a neighbor, not a family member, like nobody to do this daily injection, then you're fine to be there, right? Whether it's QD, BID, TID, maybe it's only weekdays, on the weekends there's family, I don't know, whatever the situation is. And so what I've seen a lot of companies do is in cases where it could be a gray area or whatever, is they'll send a social worker out at every episode to evaluate for a different caregiver that can replace, the clinician and the home health agency, and to validate that there is no other available caregiver for that specific, injection at that specific time. Having the social worker assess for this is going to be additional backup and proof for your ADR of the medical necessity of this case. Again, I'm not a clinician, nor am I an ADR auditor or have any experience auditing or prepping ADRs, but I have seen the results of, a gajillion companies going through a gajillion ADRs. And part of the administrative compliance service is that if you have this is right now. So in August 2025, is that if you get like let's say 40 ADR requests or whatever, we can look at one chart and just give you like technical feedback. That's not clinical feedback. We're not like running medication checks and whatever, things like that. We're just like, oh, here are all the forms that should be in a chart and whatever. Like we're doing a technical audit essentially and giving you feedback. And so because it's a requirement of the customer being in an administrative compliance program to receive this kind of feedback, at that point, and I'm not the one giving that feedback, also side note, but at that point, we then see the results of these things, And so what we've noticed a lot of times is that if you have a social worker justifying that there's no active available or willing caregiver, and that the patient is not able to perform the injection themselves for whatever these reasons, then essentially it's just like additional proof for your episode, for your ADR. But it's also one more person trying to help find the replacement for this. Because a big part of this is a lot of times these kinds of ADRs can get rejected because you're not supposed to have someone on file for 2 years or 3 years or 10 years or whatever. At some point, they need to find someone in the community that's going to help them. Sometimes people just don't have anybody, and that's fine. Like, we're not making that kind of judgment call. We're just saying that, like, you shouldn't be keeping forever patients unless it's absolutely necessary. And so if you do have one of these patients that extend forever, it's a really good idea probably to have some kind of second set of eyes validating and evaluating the medical necessity of your company to be there. So long story short, if you think that this sounds logical, I don't want you to take this as like gospel, you know? If you think that this sounds logical, please call the social worker of your company, call your DPCS, and maybe have like, you know, a little meeting between the three of you or how many ever of you to see if this is something that can work for your company. So, yeah, it's worked for others and hopefully it helps someone. But again, please make sure that you confirm with your clinical staff. So again, my name is Miriam Traceman from the Home Health Consultants, and this is Social Workers and Insulin Injections. If you like our content, please like, share, and subscribe. See you later. Bye.